So again, I'll give some brief updates on data and then talk a little bit about where we are in the pandemic and key action items that we can all take. As of this morning, we had 36,793 cases, and to date we've experienced the loss of 566 individuals in our community. We've had an increase of 301 cases over the past 24 hours. But what I want to point out that I think is most important is over the last week, we've averaged a little over 300 new cases per day. Most days we've been hovering around 200 new cases, but we've had at least 2 days where we know that we've had over 400 new cases. So anyone can do the math and know that our numbers are going up. We are seeing significant increases in a variety of areas, and our 14-day trend is clearly upward. Our reproductive rate at the current time is 1.24, which is significantly higher than 1 or less than 1, which is our goal. Our weekly test positivity rate is increasing and our duplication rate is shortening. And if you recall, we talked about duplication rate a lot in the very beginning of the pandemic. That's how quickly we double our cases. And the reason that's important is that if we've had over 36,000 cases, if we double that in a very short period of time, we will quickly be at over 70,000 cases. At the current time, we're estimating that those numbers could be that high by the end of November. So I think in the last few weeks, everyone has heard me say that I've had some concerns about where we were. We're at a pivotal time, or we're at a pivotal time in the pandemic for several reasons. One, we had seen steady decline in Shelby County, but we also know that there were changes happening statewide and nationwide. So at the current time, we are at quite a different place than we were in March. And even when we were at the end of June, when we implemented several policies, including the mandatory face masking. What's different now is that we have significant transmission in surrounding counties that will influence Shelby County. That includes influencing our hospitalizations, as well as people come in and out and back and forth between counties. So our ability to reduce transmission is quite different than it was, again, in June and early July, and then obviously in March at the beginning of the pandemic. Why that's important is that our current numbers foreshadow a very challenging fall, and I want to be very clear and direct about that we do anticipate this upcoming weeks and months are going to be exceptionally challenging for our community. But what's most important is that we can all take actions that will reduce that impact in the challenging times that we're likely going to face. So I want to reinforce some things that I've said before, and these are strategies to protect ourselves as well as our family members and our community at large. We do know it's been a very challenging year for all of us. This is an unprecedented time. We haven't seen a pandemic of this magnitude really for a century, so we're all challenged with doing the best that we can to move forward. But I want to reinforce the importance of masking. We do know in Shelby County, well over 90% of people are wearing masks correctly in public places, and that's positive. But I want you to think about where else you need to wear a mask, particularly as we look at protecting vulnerable populations. If you are in a household that's multi-generational, you actually want to wear a mask when you're around your seniors or those who are vulnerable to reduce the likelihood that they may be infected if you have COVID. If you're visiting others that you don't live with, consider wearing a mask and ensure that you're social distancing while you're in that particular household.